The basics for a nursing technician. Grab a piece of paper or something to take notes and analyze which of these topics you already know well and have mastered and what you still need to study. The basics, the bread and butter. If you don't have this well understood, the rest won't matter, okay? If you don't have what I'm going to talk about here, the rest won't help, it won't take off, it's going to be bad for you, okay? By the way, don't forget to like, share, subscribe, and send this video to your colleagues who are nursing technicians because guys, this is basic. The basics need to be really solid for any profession. And here I'm going to talk specifically about what you need to be a good nursing technician, shall we? Write this down. Vital signs. Oh, Edra, I know, but what if you don't know vital signs? I'm going to start with it. The controversial one, blood pressure. Guys, for the love of God, don't confuse blood pressure with systemic arterial hypertension. For the love of God, they're two different things. If you were taught incorrectly, that's on whoever taught you, but now it's your responsibility to fix it. You need to know what blood pressure is. So what do you need to know about blood pressure? I'm not asking for the definition. Blood pressure is the pressure that blood exerts on the walls of the arteries. For the love of God, right? If you think you know blood pressure and you know this concept, sorry, you don't really know, okay? Blood pressure equals cardiac output times vascular resistance. Cardiac output equals heart rate times stroke volume. That's what it means to know blood pressure. If you don't know this, then you don't know blood pressure. If you know the blood pressure readings for the disease, that's not blood pressure. That's already the disease. You understand? That's already the disease. So that's outside the scope of blood pressure. Second thing about blood pressure, checking. The technique for checking blood pressure. There is a technique, 90% do it incorrectly. In other words, 90% don't know how to check blood pressure according to the guidelines, okay? So first item, vital signs. Among the vital signs, I listed blood pressure. Blood pressure is not just a concept. It's about really understanding what blood pressure is. Checking technique. Forget about the disease. Disease is another matter. The person who needs to know most about disease is the doctor. They're the ones who make the medical diagnosis, not anyone in nursing. So you need to know how to check blood pressure and understand what blood pressure is. Leave the rest to the doctor. Stop wanting to know the blood pressure values, whether it's hypertension, stage 1, 2, 3, mild, moderate, or severe. Anyway, leave that to the doctor. He's the one who needs that in the office so he can make the diagnosis, change Mrs. Maria's and Mr. Jose's medication. That's not for you. So leave that to him. So it's important. You need to know how to check blood pressure using the correct technique and what blood pressure is. Leave the disease aside. All right? Second item, respiratory rate. What is respiratory rate? What are the values? What do the most common terms mean? Apnea, tachypnea, hyperpnea, hypoventilation, hyperventilation. The patient is breathing with tachypnea and hyperventilation. What does that mean? One thing has nothing to do with the other, but both can happen together. What does that mean clinically for your patient? So you need to know what breathing is. Because from there, we already gain an extra tool, which isn't a vital sign, but it's part of it. I'm talking about a vital data point, which is oxygen saturation. I'll talk about it in a moment. So, respiratory rate, heart rate. Heart rate is nothing more, nothing less than an extension of blood pressure. But we keep it separate because it's one of the 5 vital signs. So, heart rate. We have differences for adult and pediatric patients. You need to know that reference values are different, but in fact, what is heart rate? What is heart rate? What is a heartbeat? What makes the heart beat? Why does the heart beat? Why does it increase or decrease heart rate? And what causes that? Which neurotransmitters are involved? Which receptors are involved? That is really knowing the basics of heart rate. If you don't know how heart rate increases or decreases, if you only know the heart rate value, I'm sorry, you haven't learned about heart rate. You only learned the reference value, so you need to study. And the other thing is the technique for checking heart rate. Heart rate can only be checked where? On the patient's chest. So there is a technique that you will use in the region of the 5th intercostal space at the left mid-clavicular line. There is a point called Erb's point. You can check there. You can do the auscultation there. And don't confuse heart rate with pulse. So we have radial, femoral, carotid, and several other pulses. The pulse is a reflection. It's a wave reflecting the contraction. That's not heart rate, that's pulse. Because if it were the same thing, I would have heart rate here, not pulse. So if there's a pulse, it's another name, it means something else. So don't confuse heart rate with pulse. They're two different things, even though they're similar, right? I've already discussed blood pressure, respiratory rate, and heart rate. Temperature. Temperature. What is temperature, for God's sake? Stop saying it wrong. High fever, low fever, fever is fever. Now, the temperature values in a person with a fever can be only slightly elevated or much higher, so there is no such thing as low fever or high fever. If you know the temperature reading, fever is fever, period. Now, the patient has an increased temperature. That's the same as a fever. So maybe you want to say that the fever is very high. You can even talk to the public like that. But don't write that in the medical record because I've read it a lot. The patient had a high fever and received medication as prescribed by the doctor. Man, high fever? No. The guy had an increased temperature. Write down the number. What's the number? 39.5, 38.4. All of that is fever. But when you use the term fever, it's from the minimum to the maximum of what's characterized there for adults. And if it's pediatrics, with the new update from the SBP, it starts at 37.5 up to what value? After that, it's hyperthermia. So fever is fever, period, okay? Depending on the value. Obviously, the closer to hyperthermia, the more the patient is at risk with a high fever, maybe even having a seizure, especially in pediatrics. Okay? So you have to study hard, guys. You have to study. You have to sit down and study hypothermia. Maybe hypothermia isn't that common in Brazil, but in other countries it's very common. Patients often arrive with hypothermia in an emergency setting. So all of this has to be clear to you, okay? All right, pain. Pain is subjective. Pain can't really be explained here, but study pain, okay? It's not asked about much, but you need to know about pain. Pain is more about day to day. It's more about you analyzing the patient's expression, the situation, the type of pain, the kind of situation the patient arrived in, and then we reach a better understanding. So vital signs, all right? Key patient data. Now we add saturation and blood glucose. Saturation. Guys, saturation is just a piece of information to check the extremities. And this data from checking the extremities puts you in a position to understand oxygenation a bit better. But remember that the real villain in the emergency room is CO2 or capnography when the patient has it, which you should analyze more carefully, okay? Blood glucose. Although there are reference values, for God's sake, it's the same thing. Don't confuse blood glucose with diabetes. They are two different things. Blood glucose is blood glucose, diabetes is a disease. Don't confuse blood glucose with blood glucose values used to diagnose diabetes. So the first step is separate the disease from the concept of blood glucose. So what is normal blood glucose? What is hypoglycemia? What is hyperglycemia? Did you get that? Great. The disease is a different story. Then you have fasting glucose, postprandial glucose, glycated hemoglobin. There are other interesting situations as well, so that we can actually do the analyses there. All right. So this is extremely important. So we talked about vital signs, vital data. All of this will help you monitor the patient. So this will help with patient monitoring. Well, is that all for nursing technicians? No, there's also medication calculation. You need to master medication calculation. You will be administering medications, and that's not all. You have to study medication administration. So write this down. Venipuncture, overall medication administration. Understand why you're diluting the medication. Why that medication can't be diluted. Why that medication must be administered using an infusion pump. Why that medication has a concentration that requires it to be diluted. It can't be diluted. So you don't just need to know how to administer it, you have to understand the medication. And if the prescription comes in wrong, are you going to do it wrong for the patient? Remember that the querencia has nothing to do with the CRM. The CRM is responsible for him there, and you are responsible for yourself. And the rope will always break on the side that doesn't have enough knowledge. If that's you, then it's going to break in your lap. That's why I say this. The weakest person lacks knowledge, so things will fall apart for you if you don't study. You might say the doctor should know about medication, but responsibility still matters. The day the rope breaks, say that at querencia, say that at the trial, say it there. Look, I didn't study this medication. Do you understand? But why did you administer a medication you didn't know about? If it's in the code of ethics that you're forbidden to administer a medication you don't master. So that's your problem, your fault, you'll be held responsible. So I'm already warning you that this is basic, this is the bare minimum. So About medications, man, the world is huge. There's a lot for you to study, and all of this is basic. And to wrap up, nursing notes. Everything you do for the patient needs to be recorded. Whether it's by hand, which is rare nowadays, or in the hospital system, okay? Guys, this is basic. Is there more? No, for the basics, that's it. This is the most basic of the basics. Knowing this, you already have the basics. But look, I'm not telling you to study reference values for God's sake, right? I'm not here telling you to study concepts and reference values. If you want to learn this in more depth, I have a program called Advanced Technicians, because there it's an intense year where my students really dive in. Is there any of my students who watch the video until the end? Tell them what the Advanced Technicians program is like so they can understand, okay? And also there's a waiting list. There are no spots available.